Ever been deflated when a treatment didn't go quite as you planned? The patient isn't pleased, their veins appear worse, and you begin to second guess your expertise. I've been there. I know exactly how you feel. I've been in your shoes. And I'm here to tell you about the errors that can afflict even the most seasoned practitioners. Microsclerotherapy is a remarkable weapon in combating veins. In fact, experts agree and endorse it as the gold standard for eliminating leg spider veins. However, like any medical intervention, is not immune to human error. There are 7 blunders that can not only ruin your microsclerotherapy results, but may also pose risks to your patients. Let's talk about them, and let's dissect the most frequently occurring microsclerotherapy mistakes and understand how you can avoid them and set a foundation for satisfied patients and a flourishing private medical vein and aesthetic practice. The first error is incorrect patient selection. Now, consider microsclerotherapy as a bit like a jigsaw puzzle. You have to find the matching pieces in order to put them together. Starting treatment without taking a detailed medical history, checking for allergies, and a comprehensive examination of the patient is like forcing a misfit puzzle piece. Go slowly, talk to your patient, and make careful selections of your patients for microsclerotherapy to ensure top-notch results. The next error: if you can't see it, you can't treat it. Microsclerotherapy calls for attention to detail. Neglecting what you think are the most insignificant spider veins can cause unsatisfactory outcome for your patient. So, pay close attention to the patient's legs. Make use of appropriate lighting, magnification, and tools such as vein light to uncover hidden veins. Remember, the success of your injections is directly proportional to your vein mapping prowess. And check what the patient thinks is important. It may be insignificant to you, but your patient might think they're actually the worst veins ever. And that's why they're seeking intervention. Ask your patient to actually point to the veins that are bothering them. The next mistake is overlooking feeder veins. Think of simply snipping off weed leaves. They'll grow back, right? Well, the same principle applies to leg spider veins. If you don't take care of the reticular veins, the feeder veins, those leg spider veins will simply come back. You're only addressing the surface problem and you're not looking at the root cause. So, make sure you use things like transillumination to check for those feeder veins, and make sure you treat those feeder veins systematically. The next problem is overlooking discomfort that your patient may feel. Rapid, overly deep, or excessive volumes of sclerosant, these are errors which you should avoid. They're not only painful for your patient, but they will also hugely increase the risk of complications, such as hyperpigmentation, scabs. Microsclerotherapy requires a gentle technique, a gentle touch, and artistry. Deliver your treatments very, very gently and very, very slowly, with a soft touch. Make sure you angle the needle correctly so you're not going too deep, and follow the low, slow, low method. Low volume, slow injection, low concentration. The next thing that people overlook is that, it looks worse. Patients will usually expect immediate improvements. Failure to share with them that their veins will actually look worse during the healing phase could lead to panic on the behalf of your patients. Take time to thoroughly educate them about the process and provide well-documented instructions and reassure them that looking worse initially is a normal part of the healing process, a normal part of the process to get clearing of those spider veins. The next problem is failure to organize appropriate follow-up. Follow-ups are not just about good service. They're an opportunity, an essential opportunity, to assess progress and nip any problems in the bud as they occur. Problems such as retained coagulum that might lead to hyperpigmentation. It's an opportunity also for you to see your patients, see how they're feeling about things, and to reassure them they do look worse and that's normal and part of the healing process. So, make sure you schedule a follow-up appointment before your patient leaves the clinic. The next problem is documentation slip-ups. If you neglect to keep a detailed record of the treatment, the solutions used, the concentrations, the areas treated, whether the patient had any adverse reactions like pain, discomfort, or if there were any blebs that were formed during the microsclerotherapy process, you'll be laying yourself open to medical legal issues, complaints. Remember, if it's not documented, if it's not written down, it didn't happen. So make sure you cover yourself well with good documentation. Some of your patients who are requesting microsclerotherapy can be quite challenging. They might be expecting quite a lot from the treatment. So make sure you document the consent process, what you said, what you told them, the fact that they could look worse to begin with, that treatment is not perfect, and that a perfect outcome is by no means guaranteed. So, getting excellent results from microsclerotherapy requires more than just the injection technique and knowledge about the injection process. So, why don't you delve into my free course, How to Inject Leg Spider Veins and Leg Blue Veins by Microsclerotherapy, by clicking the link in the description, where I will reveal strategies to dodge those 7 pitfalls that we've discussed. And it will make sure that you keep on the right path to get great results. This complimentary mini course includes an instructional video, a handy manual, and a cheat sheet. It's user-friendly and you'll have practical tips in your hands in just 20 minutes. And did I mention it's absolutely free? If you're motivated to deliver the best outcomes for your patients, make sure you like this video, share it with your peers, and subscribe to my email newsletter. You'll get great insights into vein treatments, and I'll also share with you the fundamentals of business that lead to success in running a private practice and a private healthcare clinic.